Hello, and welcome to the EWC podcast, where we shine a spotlight on the incredible stories and impactful work being done to support breast and cervical health and well-being in our communities. I'm your host, Carmel. In this series, we'll be exploring the Every Woman Counts program, a vital initiative that provides free breast and cervical cancer screening and diagnostic services to underserved individuals. We'll hear from dedicated community health workers, program staff, healthcare providers, and most importantly, the individuals whose lives have been touched by this program. Today, in our second episode, we're thrilled to be joined by Charmaine Lopez, one of our clinical coordinators at EWC. But before we dive in, thank you all for tuning in. Whether you're a healthcare professional, a public health advocate, or someone who cares about breast and cervical health, this podcast is for you. Hello, Charmaine. To start, can you tell us about your role as a clinical coordinator for the Every Woman Counts program?
Of course. So clinical coordinators, we work very closely with healthcare providers that are enrolled in the Every Woman Counts program. Most clinical coordinators for EWC are registered nurses, myself included, and we offer training and ongoing support to our providers. So if a healthcare provider is new to the EWC program, we are the ones that onboard them to ensure that they provide appropriate and timely screening and diagnostic services per the EWC standards. And of course, if they need any assistance down the line in regards to the program, whether it's questions on patient eligibility, or if they need help finding a local provider to refer an EWC recipient to, clinical coordinators would be their point of contact. And while a majority of our role as a clinical coordinator is working with healthcare providers, we do also offer patient navigation for individuals that do reach out to us. And this can include members of the public that need assistance finding an EWC provider near them, or even someone that is already part of EWC but has questions or concerns regarding the program.
What are the recommended breast and cervical cancer screening guidelines, and what does the EWC program cover?
So for average risk individuals, the United States Preventive Services Task Force, or USPSTF, recommends breast cancer screening via mammography every other year for individuals aged 40 to 74 years. And these recommendations were actually updated recently this past April 2024 because the rate of women getting breast cancer in their 40s has been increasing by about 2% each year. So the hope is that by starting screening earlier, we could catch breast cancer sooner, especially since breast cancer is the second most common cancer for women in the United States. There are other medical groups like the American College of Radiology and the Society of Breast Imaging, and they recommend mammograms annually starting at age 40. And currently, EWC covers a screening mammogram once every year, beginning at age 40, with a minimum of 365 days between each screening. As for cervical cancer screening, this depends on the type of screening test and the age of the individual. So starting at age 21, the USPSTF recommends cervical cancer screening via cervical cytology, or more commonly known as a Pap test, every 3 years. And at age 30 to 65, cervical cancer screening can involve either a Pap test or a human papillomavirus or HPV test. And you can also get a co-test, which has questions and an HPV test combined. So if you get a Pap test by themselves, it's recommended every 3 years, whereas HPV tests, either alone or as a co-test, that would be recommended every 5 years. If you're over 65, cervical cancer screening is no longer recommended as long as you had adequate negative prior screening and are otherwise not at high risk. If you haven't had adequate prior negative screening, then there is no upper age limit, and EWC program covers cervical cancer screening tests based off of these guidelines. And of course, all of these screening guidelines are for individuals at average risk. So if someone is at higher risk for breast or cervical cancer, They might need more frequent testing or might even need to start screening at an earlier age, and that would also be covered by EWC.
Are there signs or symptoms of breast and cervical cancer that folks should be aware of before screening or in between screening cycles?
So yes, if you've never had a breast or cervical cancer screening test done before, it can definitely be helpful to gather more information about them first so that you know what to expect. So I would recommend either talking to some trusted family members or friends, and of course, talking to your healthcare provider, since they're there to answer any questions and make sure you're well informed about the procedures. Please do not be afraid to ask questions. If you are in between screening cycles, it's really important to know your body and be on the lookout for any changes. So for breast cancer screenings, just become familiar with how your breasts normally look and feel. You should perform a breast self-exam at least once a month and report anything out of the ordinary, such as new lumps or skin changes, to your healthcare provider right away. Other possible signs and symptoms of breast cancer include swelling of all or part of a breast, skin dimpling, and breast or nipple pain. And even though breast cancer screening typically starts at age 40, you should begin performing monthly breast self-exams much earlier, starting at age 20. If you're still menstruating, a breast self-exam should be performed a few days to a week after your period ends, because sometimes the hormonal changes that are associated with your menstrual cycle can make breasts more lumpy or swollen. If you're postmenopausal, then perform a self-breast exam on the same day each month, such as the first day of the month. Meanwhile, for cervical cancer, the early stages typically don't have any symptoms, which is why it's extremely important to get screened regularly. You don't want to wait to get tested until you have symptoms, because if the cause of those symptoms is cervical cancer, that usually means it's a later stage, which lowers your chance of a successful treatment. So abnormal vaginal bleeding or abnormal discharge from the vagina, pain during sex, or pain in the pelvic region may all be associated with late-stage cervical cancer, but it can also be caused by a whole plethora of other conditions. So that's why it's important to check with your healthcare provider to help determine the cause.
Most of us have heard that 1 in 8 women will be diagnosed with breast cancer during their lifetime. Are all individuals at risk? Who's considered to be at high risk? How does someone know if they are at high risk? And what should someone do if they suspect or know they are at high risk?
No, not all individuals are at equal risk for breast cancer. There are certainly some risk factors that increase your risk that you can't change, such as being born female, getting older, or having dense breasts. But there are also some risk factors that you can change, such as not being physically active, drinking alcohol, and being overweight or obese, especially after menopause. You would be considered high risk for breast cancer if you have a strong family history of breast cancer, a BRCA gene mutation, a first-degree relative who is a BRCA carrier, or a lifetime risk of 20% or greater as defined by risk assessment models. And those risk assessment models tend to be heavily based on family history as well. Now, if you suspect or know that you are at high risk for breast cancer, definitely reach out to your healthcare provider about getting screened and also discuss ways that you can reduce your risk. EWC will cover annual screening mammograms in conjunction with breast MRIs for high-risk individuals of any age. So don't wait until you're 40 to begin screening if you're in that high-risk category.
How does EWC tailor its services to meet the needs of diverse communities, including those who may be underserved or face health disparities?
Well, you've already met our wonderful health educator, jmetz, and she, along with her team of community health workers, often attend events and host classes, not only to share information about the Every Woman Counts program, but to also educate others on the importance of breast and cervical cancer screening. And these events and classes take place all over Los Angeles County, though there are certain pockets where our outreach efforts are more concentrated, as these tend to be areas where our services are most needed. So we look at data to determine what regions of LA County have the highest incidence of breast and cervical cancer mortality rates. which areas have a higher percentage of folks that haven't had a pap test or a mammogram in the past few years, and also which areas have the lowest percentage of HPV vaccination. Then we match up that data with what populations in each region are uninsured or report living below 200% of the federal poverty level. And we use that to determine which areas can best utilize the EWC program, and we target our outreach efforts accordingly. So you can find us at health fairs, soup kitchens, churches, and other venues, especially in areas where there may be a higher concentration of underserved individuals that can benefit from our program.
So what can someone expect to happen, or what is the process of enrolling in EWC and completing screening?
So if someone is interested in enrolling into the EWC program, their first step would be to find an EWC provider. In all areas of Los Angeles County, we have anywhere from 3 to 40 EWC providers within a 5-mile radius, so you're bound to find someone nearby. You can locate providers either online through the EWC provider locator found on the Department of Healthcare Services website, dhcs.ca.gov, or also by calling the EWC automated line at 1-800-511-2300. Once you find a provider, call them and let them know you're interested in enrolling into the Every Woman Counts program and getting a breast and/or cervical cancer screening. The provider will determine your eligibility and have you fill out the application paperwork during your appointment. After you're successfully enrolled into EWC, you'll get a recipient ID card that gives you your 365-day eligibility period, and also the name of the EWC primary care provider, or PCP, that enrolled you. For certain procedures, sometimes you might have to be referred to another facility, so just make sure you bring that recipient ID card with you so that EWC will cover those eligible procedures. And if there are any abnormal results, you just continue to follow up with your EWC PCP until a final diagnosis is reached. Afterwards, just follow your PCP's recommendations on when your next screening should be. And if your eligibility period has expired by the time of your next appointment, just know that you'll have to fill out another application to get recertified, provided that you continue to meet the eligibility criteria. And I know it sounds like a really long process, but it just really boils down to, number one, find an EWC provider, get enrolled into the program, get your screening test done, get recertified when the time comes, and just continue to get screened per your PCP's recommendation.
As we wrap up, is there anything else you'd like to share with our listeners?
I hope I was able to shine a light on how important it is to get screened for breast and cervical cancer regularly, especially since catching cancer early means a higher chance of successful treatment. So don't wait until you have symptoms to get checked. And also keep in mind that even though the name of our program is Every Woman Counts, that does not mean we only cover women. So men, genderqueer, non-binary, and trans folks are all welcome to utilize our program if needed. So please feel free to share information about our program with all your loved ones so that we may help mitigate the devastating effects of breast and cervical cancer together.
Thank you for joining us today on EWC's second podcast episode. We've had an incredibly informative discussion with one of EWC's clinical coordinators, Charmaine Lopez, about the Every Woman Counts program and the vital importance of breast and cervical cancer screenings. To wrap things up, remember that regular screenings are key to early detection and successful treatment of these cancers. Whether you're looking to get started with screening or seeking guidance on navigating EWC, Charmaine's insights offer a clear path forward. If you or someone you know might benefit from these services, don't hesitate to reach out to an EWC provider. And remember, like Charmaine mentioned, the program is inclusive. It's not just for women, but for anyone who needs it. You can contact the program through our online provider locator tool at dhcs.ca.gov/EWC. For personalized assistance, reach out to the local office at 3 823-647-4711. Spread the word, get informed, and stay proactive about your health. Thank you for listening, and we hope you tune in next time for more valuable discussions and updates. Until then, stay well and take care.